begin with breaking news on the health of Pope Francis. The Vatican says the pontiff is in critical condition. It adds the Pope suffered a prolonged asthma-like respiratory crisis earlier today. He also underwent blood transfusions due to low platelet count. The Vatican says the 88-year-old pontiff remains alert. Francis has been in hospital with double pneumonia and asthmatic bronchitis since February 14th. Since his hospitalization, there has been an outpouring of support from world leaders and Catholics. Dozens have gathered outside of the hospital where Pope Francis is staying to pray for his health. Priests and nuns from congregations around the world surrounded a statue of the late Pope John Paul II to pray the rosary. And joining us now is cardiologist and epidemiologist Dr. Christopher Labos. Dr. Labos, first off, thank you for being here. Now, from what you understand about the Pope's current health, how serious is this?
Well, unfortunately, there's not a lot of details in the press release that was put out in that communique. It is not entirely unexpected for somebody with a respiratory infection with pneumonia to develop asthma-like symptoms, as they're calling it. It sounds as if what happened. Here's the thing. In any type of infection like this, you can always get some inflammation, some reactivity of the airways. You can always have the patient will wheeze a little bit, will develop symptoms like that, and you would often treat them with bronchodilators, the same medications that you would give to a patient that had asthma or COPD, chronic obstructive pulmonary disease. So in some respects, this may just be what you would expect in any elderly patient that has a rather severe case of pneumonia. It is a little bit concerning that he was better yesterday and not as good today. But these types of fluctuations do happen. What you want to see ultimately is the trend towards improvement, even if you have one bad day somewhere along the road.
Is there a possibility that the Pope's condition could improve?
There certainly is. I mean, you don't ever really know what's going to happen from one day to the next. You basically just have to observe and deal with complications as they happen. In some respects, treating a pneumonia is very, very straightforward. It's a bacterial infection. You give the patient antibiotics. The challenge is always monitoring the patient and dealing with complications as they happen. So if they have a bout of wheezing, you have to give them bronchodilators. If they are struggling to breathe, you may have to administer more oxygen. If they develop complications like a low platelet count, which is one of the other things that we were informed about, then you might require a transfusion. So you often have to deal with problems as they come up, because you don't deal just with the pneumonia, you deal with all the complications that result from the pneumonia. And unfortunately, in older patients, complications are just more common.
So what do you see, based on your experience, as the next steps for the Pope's doctors?
It's probably going to be wait and see. If the Pope is still relatively okay, if the Pope doesn't need to be intubated, which doesn't sound like is the case, you really are just waiting for the pneumonia to clear, for the bacteria to get cleared from the lungs, so that the breathing can improve. Once somebody doesn't need oxygen, you generally then send them home to recover. I mean, we often think that, a pneumonia is something quick. It's actually not. Even if you and I were to get pneumonia, it would knock us on our backs probably for several days, if not longer. And in an older patient, it may take several weeks to recover. So there's going to be sort of the acute phase of getting the Pope out of hospital when he no longer needs antibiotics or oxygen. But there may be a prolonged recovery time because, unfortunately, the older you are, the longer it takes you to recover from an illness like this.
All right. Doctor, thank you very much for coming on the program and chatting with us today. We appreciate your insights.
My pleasure. You take care.